Joining us now, the co-director for the University of Michigan's Institute for Firearm Injury Prevention and the co-principal investigator for the National Center for School Safety, Mark Zimmerman. Also with us, Sandra Graham Berman, a psychology professor whose research includes traumatic stress reactions in children exposed to violence. So good to see both of you. So, Mark, you first. I mean, teachers sounded an alarm. A few alarms. You know, as someone who studies shootings extensively, what more should have been done to prevent all this?
Well, I don't know all the specifics of the case. Clearly, there were probably earlier signs than that, but this idea of identifying signs and trying to get at the issue early is really important. But I tend to try to think of this ecologically, just as we think about the trauma being not only of the families who were victims of the actual shooting, but the rest of the families in the school and the children in the school are also affected. Similarly, I think about community violence and how that might affect a child, family conflict and what happens in the family, access to firearms, and of course the school climate itself. So I think about all of those factors together in thinking about how we can prevent school violence more generally and shootings more specifically.
Yeah, all of this is just so heartbreaking. Sandra, you know, we've got 4 families now who have lost children, and there were 7 others who were injured, and their families too, you know, are grieving and suffering. But the trauma extends to every student who was in that school that day. Really, any student, you know, who, even if they weren't in school, this is their place, you know, of refuge, of safety. So what do you expect that all of them are experiencing right now?
Well, it's very clear that this was quite a traumatic event, and it affects everyone. Those who are close to the people who died, of the families of the students who died, those who had friends, those who were injured, those who were eyewitness to the events or felt their own life was threatened at the moment, but also people who are just students in the school who know someone who no longer feels safe and no longer have the same feelings about their school, but about also, you know, how things are going to go for them. I think it's important to understand that almost everyone will have a reaction of traumatic stress to such an event. For example, having nightmares, difficulty sleeping, becoming more anxious or more fearful. But most people adjust over time. Most people are able to heal somewhat and to go forward, even though they'll never forget the event or the people, but they're able to manage it. But there's a number of people who can't. And I think the immediate programs that are being made available to the students in the school, having the evening vigils, things like that, bring people together, provide the support that's going to help in that healing. But there are a number of people who may not recover over time, kind of like long haulers with traumatic stress, and those people are going to need more help, more professional help.
Yeah. Mark, I mean, the numbers are astounding. I mean, there have been 48 shootings on K through 12 campuses this year alone, 32 of them since August 1st. I mean, how does anyone make sense of why is something like why is this happening on any school campus?
Well, again, it's all the contributing factors. It's just not school. COVID doesn't help either. Anecdotally, I've spoken to educators across the country. They noted that there's been more bullying, more fighting since kids have returned to school who were not in school all of last year or most of last year. And really, firearms and shootings are the tip of the iceberg. 20 to 30% of our youth are bullied in school. 20 to 25% are report being in a fight. 3/4 report witnessing bullying in the school. Those are all precursors to the horrific event that we saw in Oxford. But context matters. That schools can do many things about changing the environment of the school. They could focus on social emotional learning, helping youth develop skills so that they can address the conflicts that they're having. There are bullying prevention programs that would provide bystander support and bystander intervention if they see somebody getting bullied, and kind of creating the environment of support rather than tension and conflict.
Well, Sandra, you touched on this. I mean, there's a trickle-down effect. There are a lot of people who are suffering from trauma as a result of this, not just the students and faculty in the schools, but the entire neighborhoods. It's all of the community. You heard the prosecutor. You heard police, law enforcement who say, this has happened to all of them. So collectively, how is everyone going to help each other heal or cope?
Well, I think you're raising a good point. It's very important to come together, to take the time to heal, to be respectful, and to help each other. For parents to talk to their kids, they don't have to have all the answers. They just have to be available to listen and answer questions that come up. But there is so much more that we can be doing on the community level by supporting more mental health people in the school system, but also mental health services available in the community. These kids don't just suddenly become this way in high school one day. This is something that's developed over time. If the parents can't see it, we need more education to help parents understand and to help other kids be able to talk about, how they're feeling, if they see troubled signs from others, etc. There are many steps that we can take. We don't have to wait until high school. The sooner we can start helping kids develop, as Mark said, develop better coping strategies, but also to get the support from the family and services available in their community. There just aren't enough services. The waiting lines are a year long for mental health.
Terrible. Well, invaluable information both of you are sharing with us. Thank you so much, Sandra Graham Berman, Mark Zimmerman. Appreciate you both. Thank you.
Thank you.